Hi guys, I'm Dr. Amy Killen. I'm an integrative and regenerative physician in Salt Lake City and Park City, Utah. I want to talk to you briefly about Rapid Rebound. This is a 3-ingredient peptide blend that I developed to help promote healing, improve recovery, and decrease inflammation. I'm really excited about this, and you can read about it on this website, but here are a couple of things to keep in mind. So Rapid Rebound is made up of 3 ingredients. The first one is the peptide BPC-157. Now, if you know anything about peptides, you've probably heard of BPC-157. BPC stands for Body Protective Compound, and it's actually naturally found in gastric juice. BPC-157 has been noted to help increase the healing of all different types of musculoskeletal injuries, including bone problems, tendon problems, ligament problems, as well as muscle and cartilage problems. It can also potentially protect against injuries in these systems. It's been shown to be anti-inflammatory. It's been shown to upregulate growth hormone receptors on some of the tendons and ligaments where there are injuries, which is one of the mechanisms by which it's supposed to be helpful. And it can also increase blood flow. It's been shown specifically in cases like osteoarthritis to help promote healing as well as improve bone healing and some of these other things I just mentioned. It's also been shown to increase skin healing in patients who have like skin burns. So there's some potential uses for things like improving after cosmetic procedures, which is one of the things that I use it for. The second peptide in the blend is called AOD-9604. So this is basically a fragment of human growth hormone. So it's just about 1/10 the size of the human growth hormone protein, but it was engineered back several years ago to try to mimic some of the positive effects of growth hormone without giving you some of the deleterious effects, like the effects on blood sugar, for instance, or on growth, for instance. It was studied initially, actually, to try to reduce weight in patients. And they looked at animal studies and human studies and found that AOD-9604 could help decrease lipogenesis and also increase the breakdown of fat so that it was possible that you could actually lose weight on it. While they were doing these studies, they also saw that they were seeing a lot of increased healing in musculoskeletal systems. So AOD has kind of shifted over to be something that we're using more for musculoskeletal healing than for weight loss, although there are some indications for weight loss potentially as well at a little higher doses than what we have in Rapid Rebound. And the third ingredient in this blend is called palmitoyl ethanolamide, or PEA. This is the good kind of PEA. If you're a doctor, you know what the bad kind of PEA is. So PEA has been around since the 1950s, and it's been shown to be really great for reducing inflammation and for reducing pain. It's been shown in a number of studies to reduce all different types of pain, chronic pain, neuropathic pain, osteoarthritis pain, and as well as decrease inflammation. And the mechanism is not completely understood, but it seems to work indirectly via the endocannabinoid pathway. This is a great alternative to NSAIDs, and actually has been shown to be superior to NSAIDs for some types of chronic pain. So for doctors like me who don't want our patients on NSAIDs, maybe before or after procedures, PEA is a nice alternative for that. So basically, you have these 3 ingredients. They work together for great musculoskeletal healing, as well as potentially skin healing. There are some neuroprotective effects that have been seen, at least in animal studies. And then there are a ton of gut healing effects as well. So we see improvement in gastric ulcers, decrease in IBS symptoms, decrease in leaky gut symptoms, things like that, as well as protection of the liver from different types of toxicity, including acute and chronic toxicities. So it's kind of a lot of stuff. And what's really cool about this blend is that these ingredients previously were only available as injections, at least the BPC and the AOD. They were available as sub-Q or intramuscular or even intraarticular injections. However, within the last year, these ingredients became generally recognized as safe or GRAS by the FDA, so we can put them in an oral capsule. And to answer your next question, the other unique thing about these ingredients is that they're all really orally bioavailable. The BPC-157, because it's found in gastric juice normally, is very stable in the stomach environment, is not going to get broken down like you might expect some other peptides, and has been shown after oral administration to still cause distant benefits, including neurologic benefits and musculoskeletal benefits. AOD-9604 has actually been shown to be more available via the stomach route than even the IV route. The half-life, if you give it IV, is very, very short, but if you give it orally, it gets absorbed well and it stays in your body a long time. And then PEA is not quite as well absorbed and available bioavailably. However, when it's micronized and taken with food, it is much more available and it can certainly have good benefits that way. So this was like the little mini version of Rapid Rebound. I'm using it with all of my regenerative medicine patients. I'm also using it with my pain patients, my osteoarthritis patients, my patients getting cosmetic procedures. I have a lot of patients who are using it and seeing improvements in exercise recovery right off the bat. And oddly, I'm also getting a lot of patients who are bringing in their Oura Ring readings, and they're showing me that they're seeing improvements in REM sleep, which is probably from the PEA, which has been shown to have some sleep benefits as well. So I would love to tell you more about this. If you have any questions, we can certainly dive into them. But for now, I hope that you will check out the website. We have some great graphs with some references to different studies, so you can go check those out yourselves and talk to my team if you're interested in ordering, because this is really, really a unique blend. And I would love for you and your patients to check it out. Thank you so much.